Patients I see are patients with arterial or venous disease, which includes aneurysms, atherosclerosis, blocked arteries going through their legs, to their brains, their arms. And aneurysms obviously means that the aorta or any other blood vessels in the body has enlarged to the point where it can potentially rupture and be a significant problem for the patient. So we take care of those. As far as veins, the veins that get clots in them, and there's the veins with the varicose veins, more cosmetic, and sometimes that aren't so cosmetic. They cause swelling and in the lower extremities, so we deal with those problems. The interesting thing about vascular is this is a chronic condition, okay? So a lot of these patients have diabetes or smokers, okay? And over the years develop chronic problems that involve the arteries. It just affects multiple areas in the body. So if one leg's involved, most likely the other leg's going to be involved as well. So it's not uncommon for us to do multiple procedures on patients. No, so we ask a lot of behavioral modifications to quit smoking, to get their diabetes under control, to get their blood pressure under control, to put them on appropriate medicines to help them prevent any additional problems.